So now we're moving on to talking about IUD use. So there's both hormonal and non-hormonal forms of IUDs. The first we're going to talk about is hormonal. So IUDs are considered a reversible form of contraception because you can remove an IUD and then it no longer serves its contraceptive purpose. So reversible hormonal IUDs, Mirena is the common brand name of this. It contains a synthetic progestin, which is released slowly as it's in the uterine cavity, basically. Mechanism of action not completely clear, but there are a few theories on how this is working. Of course, we know that the progestin has some influences on contraceptive ability, so preventing fertilization of egg by affecting enzymes in the uterine lining is one thought on how this is helpful. Production of prostaglandins, affecting sperm or egg mobility as well. May prevent ovulation. We know that's a feature potentially of progestins, and cervical mucus changes due to the progestins, as we've talked about previously with the oral contraception. So there's a number of different mechanistic considerations. Some of it is the progestins themselves and how that's affecting things like cervical mucus changes, but some of it is also the IUD itself and how that might influence uterine lining or other factors. Benefits of Mirena or the hormonal IUDs. It is a long-term contraceptive device, yet it is reversible, so that's a benefit potentially. It's used in women, or could be used in women with contraindications for estrogen. It is immediately effective once it's inserted. It is a reversible form of contraception. Because there's no estrogen, it's okay for breastfeeding, smoking women. It does help symptomatically at decreasing dysmenorrhea in most cases. And comparing the hormonal IUD versus the copper IUD, which we'll discuss next, overall the hormonal IUD is a little bit better to help with heavy periods than the copper IUD. So that's just one potential pro of hormonal versus non-hormonal. And in general, the statistics suggest that there's about 70 to up to 90% less blood loss per cycle. So for people that have heavy periods, this is potentially a useful intervention for that. Risks or side effects or cons of this therapy. It does require a prescription. It doesn't protect against STIs or HIV. Bleeding irregularities can definitely happen with this form of contraception as well. So spotting between periods and things of that nature, or amenorrhea. Perforation, insertion, infection, these are rare, but definitely are still concerns. Expulsion, again, is rare, but still a concern. Functional cysts can happen and are reported with IUD of a hormonal nature. And spotting can definitely happen, at least initially with this therapy, as the endometrial lining is thinning overall. So that's something to keep in mind, but it's generally more of a temporary thing. Okay, and we're now going to move on to some natural methods of contraception, focusing on fertility awareness or family awareness method. So family awareness method is based on the observation and charting of scientifically proven fertility signs that determine whether or not a woman, or give indication whether or not a woman is fertile on a given day. And with the family awareness method, couples are abstaining from intercourse during fertile days or using barrier methods of contraception on those fertile days to prevent exchange of bodily fluids in terms of a contraceptive method. So what this entails is daily monitoring of certain fertility signs. So one of these factors being waking temperature or basal body temperature, which is an oral temperature reading that's done every morning on waking. Another one is cervical fluid throughout the cycle, and the last one being cervical position throughout the cycle. So this method is not predictive of ovulation in a current cycle, but rather of future ovulation and cycle patterns. So basically this information is telling you once you have already ovulated. So the when someone is keeping an eye on tracking this, you're getting a pattern of these fertility signs over multiple cycles to see if you are fertile or not fertile, and then using that information to gauge future cycles, basically. And then taking charge of your fertility is a really good resource. This is a book which discusses this method in a lot more detail. Can be used for contraceptive means, of course, and also can be used for trying to get pregnant as well. So benefits of this method, of course, not hormonal, no need for hormonal contraception. Does also increase body awareness or someone's awareness of their reproductive cycles, of fertility, and is low cost or free overall. Really, the cost associated with this is very minimal, but there may be like the requirement of a thermometer, which is an insignificant cost. So overall, the cost is quite low. For risks or cons, to achieve the lowest failure rate, which is between 1 and 20% depending on the studies, this requires about 10 to 20 days of abstinence each month. This partially depends on how regular your cycles are, but that's definitely one potential con. Is a lower efficacy option than some of the other methods that we've talked about, and does not, of course, protect against sexually transmitted infections. Another benefit is also, again, because it's not a hormonal treatment, you're avoiding a lot of the possible side effects that tend to be associated with the hormonal treatments that we've discussed. And then I guess another potential risk or con of the therapy is there is a little bit more planning involved in this type of procedure, at least initially, for a woman to be aware of their cycle in a little bit more detail. So at least initially, there's a little bit more planning involved in using this as a contraceptive means. Efficacy of fertility awareness method or family awareness method. Overall rate of pregnancy is about 20% with typical use. So not the best efficacy, but can be useful, and the efficacy can be improved based on the how well the technique is done. The cost, relatively inexpensive, as I mentioned. Side effects, pregnancy. So this is usually more from risky behavior rather than failure with the method, but definitely worth considering. And overall ease of use, not as great. This does require dedication and commitment, especially with the female, to be aware and track the cycles and get a good awareness to use this method more appropriately. Other than the thermometer in terms of cost, which thermometers are quite cheap, the other costs possibly might be books or education on this method a little bit more, which again would be quite inexpensive. And then a lot of people also use apps to help to track all this information. Again, there's a lot of free apps, so that probably shouldn't be a cost barrier for the patient overall. Prior to starting using this as a contraceptive means, both partners should be evaluated for STIs, as with any non-barrier method that doesn't protect against STIs. And overall, this method is most effective when you abstain during the fertile period versus using barrier contraceptions during the fertile period. And partially, the other concern with barrier contraceptives is if you're using something like spermicides or lubrication, this could obscure the cervical mucus, which would give you some inaccurate information from the cervical mucus portion of this tracking. So again, something to educate patients about. Overall, basic considerations in terms of tracking or giving information through this method: a female is considered to be fertile for about 24 to 48 hours of each cycle prior to ovulation. Sperm can live about 5 days in the right environment. So overall, when you look at the math of this, it leaves about a 9-day window of abstinence with a safety buffer that they're factoring in for this. So BBT we talked about briefly already, but BBT is basal body temperature, which is a first morning waking temperature. So with the pre-ovulatory temperatures and post-ovulatory temperatures, those numbers are listed here, but basically you're using every morning a waking temperature and then graphing that out or using an app to graph that out to look and see if there's a temperature rise throughout the cycle or about at the midpoint of the cycle. So a rise in temperature that happens around mid-cycle Normally that's between zero point 0.2 and zero point 0.4, or sorry, about zero point 0.2 degrees Celsius or about 0.4 degrees Fahrenheit. What that would indicate is that ovulation has already occurred, especially if the temperature remains elevated after that point. So the reason that your temperature rises is due to increases in progesterone that are released from the corpus luteum after ovulation. So basically, you're going to see that temperature spike or small temperature spike after ovulation has already occurred that cycle. For basal body temperature, you're instructing the patient to take their temperature as soon as they wake up. This is before getting out of bed or moving around, because that can influence and rise or artificially rise temperature. And ideally, they're tracking their temperature at as close to the same time every morning as possible. So it's generally recommended that you're tracking your BBT within 30 minutes or so, the same time every morning. And the reason for this is, for example, if someone sleeps in one day and takes it 2 hours later, your temperature will slowly increase throughout the morning, so you won't get as accurate of a reading that morning. There are some factors that can influence waking temperature that can give you inaccurate results for basal body temperature. So a few of these are listed here, like alcohol, having a fever, not getting a great sleep, of course not taking it at about the same time every morning, electrical blanket, which would heat you up. So some other considerations just that might influence the accuracy of a result on a day. And this is a diagram just looking at, a very basic BBT chart. And then you'll see here if the oral temperature is tracked throughout the cycle, that there is a significant elevation in temperature occurring around ovulation. So that first day that the temperature had spiked would be the day after ovulation. And because you're seeing a consistent increase in the temperature after that point, that would indicate that ovulation has occurred and there's an increase in progesterone production. And then this is another chart. Again, this one's a little bit more detailed. So there's some other information that is documented near the bottom that they're keeping track of, like cervical mucus, for example. And this, again, you'll notice that there is a consistent increase in temperature around mid-cycle, which would indicate that ovulation had occurred. So this is something that could be tracked manually, or a lot of people will track using apps. So one of the common apps is called Fertility Friend. This one is free to help track basal body temperature and some other findings. So this can be used for as a contraceptive tool as well. So with this method, we talked about two other things that are tracked. The next would be cervical fluid testing or cervical fluid tracking. For cervical fluid or cervical mucus, there should be a relatively distinct pattern that happens with the female throughout their cycle. Cervical fluid is kind of like seminal fluid for a male. So men are continually or always fertile, so they're continually producing seminal fluid. Women are fertile for a few days in the month, and they're producing fertile fluid for those specific days. So cervical fluid acts as a more alkaline medium to help protect sperm from an otherwise acidic environment. So fertile cervical fluid will help to protect the sperm and aid in sperm's passageway into the uterine cavity. In terms of what happens throughout a menstrual cycle, overall after menses, a female will produce relatively little cervical fluid or cervical mucus. Then they will produce small amounts of sticky cervical mucus. After that point, it will become more lotion-like in consistency. And then at the more fertile time, which is around or just prior to ovulation, the typical female will notice some slippery and stretchy mucus overall, which is the fertile type cervical mucus that we discuss. So overall, wet fertile fluid is described as looking like an egg white or egg white in consistency. And it does have a high water content, so female may notice that there's like a round symmetrical pattern on underwear overall. Cervical fluid that is more fertile, that we talked about, like that egg white consistency, is revealing impending ovulation. So ovulation is about to happen. And basically this diagram is showing you that the cervical fluid is quite stretchy. So if you were to have it between your fingers, you could actually stretch that cervical fluid out quite a bit. And this is also a feature of the cervical mucus that allows the sperm to penetrate through it appropriately, so it aids in sperm passage. So that's one of the characteristics as well of fertile mucus. The last thing that a female would track potentially in the family awareness method is cervical position. The cervix also goes through cyclical changes throughout the cycle. It becomes soft and more open around ovulation to allow sperm to pass through. And it also, during ovulation or close to ovulation, will help to rise, or will rise, due to the estrogenic effects on the ligaments that are holding the uterus in place. So it's actually moving the cervix closer to where the egg would be in the uterine cavity. So an acronym to remember around ovulation, what's happening with the cervix, is called SHOW. So the cervix will be soft, it will be high in the vaginal canal, it will be open, and it will be wet or produce fertile wet cervical mucus. And these are just two images to show or to try and demonstrate those differences that you're going to see. So the first image is during the infertile phase, the os is closed, the os or the cervix might be angled slightly, versus day before ovulation. In this image, it's on day 20 for this female. The os is open, the cervix is high, and then you're seeing egg white fluid as well. And this is a website if you want to look at more pictures of cervixes called beautifulcervix.com, so that could be a good resource for you for learning purposes as well. And I'm just going to briefly go through some basic rules of the family awareness method. Of course, if you wanted to learn more about this or educate your patient more about this, looking at some additional resources is quite helpful overall in that book that I mentioned as well. But overall, it's suggested to start this only after at least 2 months of charting, because like I said, this isn't telling you when you're about to ovulate necessarily, but after you've already ovulated. So getting a bit of data for the first month or two will let you show more consistently or give you a bit more information about when your fertile versus infertile periods would be, to use this as a contraceptive means. It's best to use if you have regular periods, and you can definitely understand why this would be the case. If your cycles were quite irregular, it's hard to predict future cycles based on the data you're getting from previous cycles. So it won't have as effective of an outcome for birth control. So general rules also would be that you are not fertile in the first 5 days of your menstrual cycle. So that would be days 1 through 5, when generally speaking you are having a period, as long as there was an obvious temperature shift in the 12 to 16 days prior, which would indicate that you ovulated in that prior cycle. And before ovulation, another general rule is that you're safe the evening of a dry day after 6 p.m. The day after intercourse is marked with a question mark because sperm can obscure accurate readings of the cervical fluid. So basically, you wouldn't really use the data from that day because the reading of cervical fluid, which is one of those fertility signs, wouldn't be accurate necessarily. Another factor or general rule is you're safe the evening of the 3rd consecutive day of a temperature shift above the cover line. So this means after having 3 elevated temperature days that happen after mid-cycle, that would indicate or give you confidence that you had ovulated, you are getting a consistent rise in progesterone, and you are 3 days away from ovulation. So you should be safe to have intercourse at that point. And the following rule is quite similar, basically. So there are some things that can compromise how effective this is as a tool for contraception. We talked about already how things like alcohol and fever can impact BBT charting. Vaginal infections can impact readings of cervical mucus accurately. PCOS, you're going to have more irregularity in your cycles, so it might not be the best option for you in those cases, or generally speaking, if you have irregular cycles or irregular sleep patterns, just the ability to chart and track some of these things accurately might be impaired. And then this slide is just listing some other calendar methods that are used in terms of natural contraceptive methods. So there's calendar or rhythm methods. These typically just rely on a calendar and not using physical signs of fertility. There's justice and the sympatothermal method, natural family planning, which more usually has religious connotations about abstinence, and then the Billings ovulation method, which is just relying on cervical mucus versus some of those other factors. So just some other options to know that exist, and you can definitely look into those more if you'd like to as well. For efficacy of FAM, studies, overall results tend to be best when there's abstinence in the fertile window, which we discussed. The studies aren't the best quality. There can be pretty high attrition rates overall because of compliance issues. But from what we do know, with perfect use, about 1.8, so about 2 out of 100 women become pregnant after about a year or 13 cycles. The typical user failure rates are closer to 8 to 20% or so. And here's just a few studies that you can refer to on family planning. Another method, or that is more natural, withdrawal method. So this is basically withdraw a penis from vagina before ejaculation happens in terms of intercourse. This method really should only be used if pregnancy would not be devastating, because it's not a super effective means of contraception. The efficacy would typically use a failure rate of about 19%. Benefits, it's better than no form of contraception. Free, no pre-planning necessarily involved. Main disadvantage is it requires skill and practice, so that you might want to use condoms in that phase where you're trying to get more skill and practice in the technique. And it's, I guess the other major disadvantage is it's not the most efficacious form of contraception. Breastfeeding is also a natural method of contraception, where this is also lactational amenorrhea. So what's happening physiologically, stimulation of the nipples encourages prolactin stimulation, and prolactin inhibits gonadotropin release to inhibit ovulation. So breastfeeding is a natural method that can prevent pregnancy overall because of that. So breastfeeding is generally considered effective as a contraceptive means. So perfect use ideally would be like 98% effective for up to 6 months after labor for a female, if she meets certain criteria. So basically the women to have that 80 or 98% perfect use, you wouldn't want them to have had a period since birth, feeding baby from both breasts at least 6 times daily, feed on demand at least every 4 hours, nighttime feedings every 6 hours, and then not substituting other foods for breast milk, and then not relying on the method after baby is 6 months old. So if someone is breastfeeding and breastfeeding meeting these criteria, so breastfeeding quite frequently, which is encouraging frequent stimulation of breast tissue, hasn't had any periods over or up to 6 months, this can be a fairly effective contraceptive tool for up to 6 months after labor and delivery. Other timing type methods, another one that's more technologically based is fertility monitors. So there's a few different fertility monitors that exist on the market, like Lady Comp or Baby Comp or Pearly Monitor are a few. These are a little bit more costly. Average price would be around $500 or so. What they're doing is these fertility monitors do biomathematical forecasting calculations using computer technology to predict when you would be fertile and when you would not be fertile. So it quickly takes temperature. It's comparing the data to a whole bunch of other cycles to mathematically calculate fertility within the next 24 hours or lack thereof. So final points to consider in summary for contraception based on what we've discussed so far. So considering the benefits, the risks, the effectiveness, the cost of therapy, side effects, ease of use, personal choice. These are all considerations to discuss with your patient in terms of providing some education on to help them choose what form of contraceptive is best for them. The key would be proper use and compliance with the therapy as well. Definitely something in terms of education for a patient should also be discussing that pregnancy can carry considerable health risks as well. So considering the risk benefit of different therapies, you also want to consider that pregnancy, if not desired, can carry considerable health risks as well. Regular PAPs are required for hormonal types of contraception. We talked about the increased risk of cervical cancer with some forms of hormonal contraceptives. So that's something that you'd want to encourage with your patient. Remember that failures and risks do occur with each type of birth control overall. And overall, every method of hormonal birth control based on research is safer than pregnancy. So again, we did discuss a number of cautions or side effects associated with different forms of contraception, but we know that pregnancy confers considerable risk as well. Okay, we're just going to briefly talk about male hormonal contraception. So this is kind of like the male pill. So the theory behind this, again, is involving suppression of gonadotropin hormones. So growth or GnRH antagonists and progestins are typically used or thought to be used for this, plus adding back in an androgen to maintain male sex characteristics. And this is still in the concept phase, but it has been proven effective as of the amount of research they've done so far on these therapies. There's no products on the market yet that are approved by Health Canada. But overall, what they've seen with this so far is they do decrease sperm parameters quite significantly to about 1 million per mil, and this seems to be an effective contraceptive mean. And here's just a study that you can refer to talking about male contraception overall as a possible future contraceptive means as well. And there's also a bit of research going out there. Again, it's preliminary at this point, but using ultrasound on the testes as a means of reversible contraceptive in males. So there's a few links to some articles here that you can read about that. But there has been some research on, again, animal models, some more rat models, showing that low-dose ultrasound applied to the testes can shut down sperm production. There's a few theories on how this might work. So one might be there is some heating effects of ultrasound, so that can cause a lack of spermatogenesis. And another theory is it's disrupting proteins and gene expression in the cells that impair sperm development. So that's kind of interesting, but again, quite preliminary. And the last final topic area we'll discuss is abortion. So objectives of this portion of the lecture, one is identifying appropriate gestational period for elective abortion, describing alternatives to elective abortion, and listing and describing methods of medical and surgical abortion. So first we'll talk about emergency contraceptive. So this is any form of birth control that is used after intercourse but before implantation has happened. So it's not intended to disrupt an established pregnancy, but rather to prevent pregnancy at an early stage. How this might work is by delaying or interfering with ovulation, sperm motility, endometrial lining, cervical mucus, zygote adhesion, development, or transportation. So a few different steps in that pathway between intercourse and implantation or development of an embryo. And this is recommended for use within 3 days or 72 hours of unprotected intercourse. So the more familiar one that people are aware of, which is available in Canada for emergency contraception, is called Plan B. This is available over the counter. There is no prescription needed for this. It is a progestin-only pill. There's two different ways Plan B can be accessed. One is a 1 pill dose, or the other is 2 pills taken 12 hours apart. And this does show pretty good efficacy at reducing risk of pregnancy if it's initiated within 72 hours of intercourse. So if taken within 72 hours, the efficacy is 89% at preventing pregnancy. If it's taken even sooner, which is encouraged if possible, if it's taken within 24 hours, 90% or 95% effective. Plan B overall has been found to be less effective for overweight or obese women. And we already discussed previously in the lecture about some hormonal contraceptives not being as effective for overweight or obese women. And we talked about some potential theories metabolically why this might be the case. So we see that as well potentially with Plan B. So overall, there's a resource that you can read that gives you a bit more detail on how obesity or being overweight might affect hormonal contraceptive in general. So you can definitely give a read at that for a bit more information on that overall. Some of the studies recently, or more recent research, discusses with emergency contraceptive that there could be about a 2 to 4% increased risk of pregnancy if someone was obese versus a normal weight. There still, of course, is a decent level of efficacy, but just something to keep in mind that it might not be as effective. So elective abortion overall has been legal in Canada since 1988. It can be performed in a few different settings. So there's abortion clinics, hospitals, birth control clinics. So 90% of abortions in Canada take place before 12 weeks of gestation, so in the first trimester. But they can be performed up until week 23. Abortion overall, based on statistics and mathematics, is about 20 times safer than childbirth overall. So in terms of safety concerns or anything like that, that's something to be aware of. And spontaneous abortion, by definition, is miscarriage if it's prior to 20 weeks of gestation. So first we'll talk about surgical forms of elective abortion. So this is using surgical instruments to remove the gestational contents of the uterus. The first we'll discuss is DNC, or suction aspiration, or suction dilatation and curettage. This is one of the most common techniques used for abortion. So about 90% of abortions in Canada use the DNC technique. You're using either a local or general anesthetic with these women. And what they're doing with this procedure is opening the cervix or dilating the cervix by inserting a series of tapered rods and then inserting a hollow tube into the uterus, which is attached to an aspirator, and suction is turned on. It's moved back and forth within the uterine cavity to remove any tissue that is existing. Advantages of a DNC in terms of elective abortion: the recovery is not too long, so 1 to 2 days of recovery. The patient can resume normal activities within a week. It can be done within the first trimester and later in the first trimester. Most often it's successful and the first attempt is complete. And there's no research showing any long-term effects on reproductive health with this technique overall. Some disadvantages of a DNC technique: it does require someone to come with you if you're given general anesthetic. Someone will have to drive you home. After a DNC technique, there can be menstrual-like bleeding happening for up to 2 weeks. So that can be a possible side effect. There can technically be serious complications as well, like infection or damage to the uterus. These are quite rare though. And abdominal pain and cramping based on or as a consequence of the procedure are also relatively common. Another procedure which is somewhat similar that can be used a little bit later, so from 13 weeks onward, is called dilation and evacuation. This is using a local anesthetic. There can also be medication to reduce anxiety and pain which may be offered. The cervical opening is again dilated. This is done typically the day before the procedure. And surgical instruments and mechanical suction are used to remove the contents of the uterus. This type of elective abortion is oftentimes conducted for fetal demise or serious genetic abnormalities. Advantages of this type of procedure, again, recovery is fairly quick, 1 to 2 days or so, normally activities within a week, and this is available a little later on, so in the second trimester of pregnancy. Disadvantages, it does require someone to come with you based on the type of anesthetic used. Again, there can be bleeding, menstrual-like bleeding for up to 2 weeks or so. Cramping and pain are also fairly common. And there can also be nausea, cramping, or bleeding from the dilators that are used. So with this type of abortion, there's 2 common methods to dilate the cervix. One is misoprostol, which is a pill that contains prostaglandins to soften the cervix. And the other would be osmotic dilators. Osmotic dilators are small devices that are placed in the cervical opening, which will absorb moisture and gradually open the cervix. So those methods to dilate the cervix can also cause things like nausea, cramping, and bleeding as well. And another thing we'll talk about is the using pharmaceuticals to empty contents of the uterus as well for elective abortion. So methotrexate and misoprostol is one combination of medications that would help to cause elective abortion. This can be used up to 49 days gestation. Methotrexate is a drug that's commonly given to individuals with other conditions like psoriasis or immune system diseases or cancers because it's a chemotherapy. But in terms of elective abortion, it is weakening the attachment of pregnancy to cause fetal demise. And this is either given orally or by injection. So that's the methotrexate component. And then methotrexate is followed by misoprostol 2 to 7 days later. And misoprostol causes the uterine muscles to contract and causes the cervix to open to help expel the contents. And misoprostol can be done orally or vaginally. So with this combination pharmaceutical technique, the uterus is commonly emptied after about 24 hours of the second medication, but may take several days to fully complete, up to 9 to 16 days. Pain medication may be offered to manage cramps as the pregnancy tissues are expelled. And then a follow-up exam would be done several weeks after the injection to ensure that the procedure is complete. Part of the reason that this is done is also because the medications can cause birth defects, so they want to make sure that the procedure is complete and there's no viable embryo after this point. Advantages of this combination of pharmaceuticals. Sorry, I just had to go back here. Advantages of this combination of pharmaceuticals. So there is this is avoiding surgery and damages to the uterus that happens during, a typical operation potentially. It's less invasive than surgery in that way and more private than surgery because most of the procedure is occurring at home. So those are a few possible advantages. For disadvantages, it does require 2 doctor's visits, the first for the injection, the second for that follow-up exam. It does take place over several weeks. So that process of abortion is taking place over time. There is a risk that it could be incomplete and then require a surgical abortion. There are side effects like nausea, vomiting, hot flushes, diarrhea, cramping, heavy bleeding. So those are some of the more commonly reported side effects of this combination of pharmaceuticals. And another disadvantage is the experience would be similar to that of a natural miscarriage. So that could be a disadvantage for a female as well. And then another combination pharmaceutical elective abortion route is using mifepristone and misoprostol. So mifepristone blocks the action of progesterone and causes the uterine lining to detach. This is used up to 10 weeks after the start of the last menstrual period or 8 weeks gestation. And this has some side effects of cramping, bleeding, of course, because the uterine lining is detaching, nausea, vomiting, diarrhea, fever, those types of things. And then you would use this in combination with the misoprostol, which we already discussed. For any type of abortion procedure, for 3 weeks after the technique, there is the general advice for the patient not to engage in intercourse, douching, tampons, swimming, or using hot tubs. So these recommendations are made on the basis of increased risk of infection as the tissue is healing. So that's just another thing to keep in mind after an elective abortion that a patient would be advised to be aware of. And in general, to talk about like naturopathic care and how we can additionally be involved in the process or in that supporting a patient that's going through elective abortion. So definitely discussing and giving some discussion on supporting decision of patient, acknowledging the emotional state and difficulty of the decision with the patient. So providing some counseling in that nature. We can support the healing of tissues in terms of supporting that healing after the abortion itself, and then referring for counseling as appropriate. These are a few additional resources that you can use and can be used yourself in terms of education, but also used for patients. So the Bay Center for Birth Control is an online resource you can look at. Taking Charge of Your Fertility, we discussed that book already for the fertility awareness technique or family awareness technique. And then there's the Fertility Friend app that we talked about, as well as another resource online. And that summarizes our discussion on contraception and abortion. If there are any questions about this material, I would suggest to use the Moodle forum to relay any questions, or additionally, you can reach me through email and I'll be accessible that way to answer any questions.